Hello, I'm Scott Clover, and you're listening to the Intuitive Energy Podcast. This podcast series is about intuition, healing, and creating new energetic patterns that benefit you in your daily life. In my private practice, I help people heal from a diverse range of issues, including self-acceptance, trauma release, managing anxiety, emboldening self-worth, and creative expression. Hi, welcome to the Intuitive Energy Podcast. This week, we're speaking with Amy Bonaduce-Gardner, who is the owner of Prism Movement out of Portland, Oregon, and she is a holistic biomechanist. I can speak personally. I've been working with Amy on and off for the last few years, and she has allowed me to move pain-free. From when I met her, I had pain in my toe and my knee, and I can safely say today I am thankfully pain-free. And her work deals a lot with the nervous system and the different chambers and valve systems that works within our bodies. I am completely fascinated every time her and I speak. I have a couple aha and wow moments during every session. And she does a very interesting technique that I will let her describe. I call it body mapping, and it makes me feel better in my body, which is a goal that I have in my practice. So I'm very thankful that I'm able to, with the intuitive clients that I work with or the clients that I serve, I'm able to very thankfully refer Amy to have a more corporeal or body integration to the work that I do. So without further ado, let me introduce Amy, and she can describe a little bit about being a holistic biomechanist.
Thanks for having me.
Oh, it's my pleasure. I wish more people knew about this. I know from referring you to several colleagues and clients and a friend, I'm going to speak of a friend here. A friend worked with you for months, and I saw her for lunch, and she said, "Oh, Amy, the whole nervous system thing is I'm reevaluating who I am as a person, and it's made me a better mom."
Yeah.
So you're a mom. How can regulating your nervous system make my friend a better mom? She was over the moon with how she was relating to her children. But how can working and body mapping from a corporeal standpoint make her a better mother?
Well, for one, our children mimic our nervous systems. So they will mimic the nervous system of their primary caregiver, which typically is mom. So if mom's nervous system is dominantly fight or flight, then so is the child's. And then that becomes a bit of a cycle, and the whole parenting thing makes everything for everybody very difficult. On the other hand, if mom is dominantly parasympathetic, then the child will also mimic that. And then that changes the dynamic between the two of them.
And it allows them both more sensory input.
Absolutely. Absolutely.
So
and
that increases compassion and empathy, I would say.
Absolutely. And as a parent, if I'm able to look at my child, and perhaps, let's say I'm parasympathetic, but for whatever reason, my child is not mirroring me at that moment, and they're fight or flight, and then I can simply look at the situation for something other than what's negative and bothering me about it. I can perhaps look at it and say, oh, my child is this stage, right? How can I intervene in such a way that I'm not controlling them, I'm not making them be something, but I can shift something about their environment and thus change their sensory input. And then that will influence, because nobody can change their nervous system. I can't change mine. I can make myself be fight or flight, I should say, but I cannot choose parasympathetic. I can influence it, but I can also influence my child's environment, and thus my child's nervous system can more appropriately choose which operating system is appropriate.
So it's mimicry. It's childhood mimicry to the parent, because the nervous system of the child mimics the parental nervous system, particularly with the mother.
Yes.
And that starts at conception, correct?
It does. And if there's a vaginal birth, however, the pressure of going through the birth canal is considered to be a bit of a reset button. And then after the baby's born, then that's where the mirroring comes in.
Got it. And that's why I ask generally my clients, are there any C-sections in their family?
Sure.
Because people who have had C-sections have a different perspective on their arrival onto the planet.
And then from a nervous system perspective, the pressure of going through the birth canal, that pressure stimulates their valve system, right? It's a ton of sensory input, which is why it's considered to be the reset button. And so if I don't get that, then I'm born with whatever nervous system my mom had when I was neuro.
And so that's why some people who have not gone through the birthing process and gone through the C-section, they can actually rebirth themselves by like squeezing through tight things, and that will sort of reprocess from a childhood brain.
Sure.
It's amazing. It's amazing. So let's start. What's a holistic biomechanist?
So the official title is the Fajardo Method of Holistic Biomechanics, which means that I primarily interact with people from the lens of their nervous system. And so whether I'm working with people such as you that have pain or movement difficulties, or I have clients that are working through depression or anxiety issues, or I have clients that have chronic illnesses, we address that through the lens of their nervous system. More specifically, we look at the autonomic nervous system, which has two branches coming from there. One is the parasympathetic, nicknamed rest and digest. And then the other one is the sympathetic, or the infamous fight or flight branch of our nervous system.
So that term always confuses a lot of people. And I would like to say, if you think of it in terms of sympathetic, it's that you're overly open, right? So the parasympathetic means you're more regarding your own self, whereas sympathetic means you're open to other interpretations and other energies, making you vulnerable. Is that another way to think about those two terms?
Possibly. Parasympathetic is actually where our sensory hoses or uptake of sensory information is increased. And it's usually at its most ideal level of uptake. It's also referred to as homeostasis. The nickname rest and digest, I think, is actually very misleading, but generally homeostasis, where we're at an optimal level of function, that takes place in the parasympathetic side. Whereas the sympathetic side, there's a decrease in sensory information coming from our both internal environment as well as our external environment.
So one of the concepts that I find so interesting with you is when we do work together, you talk about the chambers or valves in the body.
Yes.
Can you give a little update about that, or a little insight to that? And then we can talk more about the nervous system and the stages of fight or flight.
So there are 7 valves of the valve system, and the one that most people are familiar with is your diaphragm, so your breathing muscle. And the valves in the valve system, some people think of them as diaphragms, and the diaphragm breathing muscle is one of those diaphragms. There's 2 that are more fascially based in the head and commonly known as the cranial sacral valve, and a lot of people are familiar with that because they've experienced or have heard about some sort of cranial sacral therapy or cranial sacral massage. There's also one in the throat neck area that's often referred to as the omohyoid valve. The musculature of your pelvic floor is another valve. And then the muscles and fascia in the bottoms of your feet are valves number 6 and 7. And the space in between those, so for example, the space between your breathing muscle diaphragm and your pelvic floor, that space in between is often referred to as a chamber. And so that's your pelvic abdominal chamber.
Interesting. I remember I was going to ask you about the feet, because sometimes when we work on the feet, you'll say, oh, your valve or your chamber opened or shifted in your feet. And I can actually feel it in my cranial. I can feel like the bones shift a little bit in my skull while we're working on my feet. How is the nervous system able to regulate all that at the same time?
So the valve system, first of all, they work as a team. And if we're in parasympathetic, there's a particular manner in which all of them move. It might not be perfect. There might be some imperfect aspects to it, but they're definitely functioning at a somewhat well level. Again, perhaps not perfect, but it's functioning at a decent enough level that I can maintain homeostasis. And it has a level of coordination. So when I'm mapping some part of my body, if I'm mapping something in my feet and the valve in my foot changes, because all the other valves are working as a team, the other valves also will shift and adapt at least to some degree, at least a little bit. Perhaps not as big of a change that occurred in your foot, or even if we're paying attention to the foot, sometimes there's a change in the head that's actually a bigger change than what happened in the foot.
So to clarify, these valves are like pressure centers. So the pressure actually changes inside the body. Correct?
So the valves themselves are really, they're muscles or fascia, and it's usually both. It's a combination of both. But their function and their movement is what regulates how much internal pressure my body has. And so I defined internal pressure as a combination of fluid, such as blood, water, nutrition, hormones. There's also air. Air is a pretty big component of that. And my valve system regulates how much pressure is in my chamber or not. If I'm more in a fight or flight dominant state, then generally those valves, the movement of them slows down or it stops. And so I might have an imbalance of pressure from one chamber to the next. So for example, my head and my pelvis might have a really low level of pressure, but my chest cavity might have an increased level of pressure.
Interesting. Can you put that in more layman's terms?
So pressure, you can kind of think about it like tire pressure. We just don't have a fancy gadget to measure it. And so when there's a decrease of pressure, there's usually a decrease of fluid and or air in that area. It might mean that my pelvic bones are kind of pulled away from the surface of my body. In the head, it's experienced a pressure change is experienced as a headache or a migraine. So lots of us can relate to that one. But the headache in and of itself doesn't indicate if my pressure is increasing or decreasing. It just means that there's been a change. And if there's an abrupt enough change or a dramatic enough change, it's often experienced as a headache.
Okay. So people may be wondering, why am I having you on the Intuitive Energy podcast? And the reason why I wanted to have you on is because a lot of people and my clients think what I do is magic. Whereas I see, I'm just seeing and sensing energy or using intuition. So for me, it's more of my standard practice. But when I work with you, I mean, I've said this several weeks in a row, I feel what you do with me feels like magic to me.
Sure.
Because I'm able to see and feel inside my body in a way that it's not an intuitive sense, it's more as an innate knowing or an innate shifting of the nervous system in being observed. So can you talk a little bit about the body mapping process and why I find that so interesting and so important? And you've worked with me long enough to know that every once in a while, I'll have a moment where my body wants to either release a story or the musculature. I remember once we talked about a car crash I was in my teenage years, and my body still remembers that. And we released that fascia in that area, and I had a reflection of the car accident. And yet my shoulder felt better the next week. So it's like the body bears the brunt as those examples of the fight or flight response or triggers in our childhood trauma, things like that. Those get locked in our body. What you do actually allows the body to release those stories from a corporeal or fascial sense.
Correct. And so when every experience that we've had, whether it's a traumatic one or something else, has a physiological motor pattern associated with it. And it's usually easiest to understand if our memory or experience is something that's more fight or flight based or more trauma based, and it gets stored, so to speak, in the body. More specifically, we have a motor pattern or a motor reflex, more likely is the case, not a pattern, but a reflex that is associated with that memory. And so every time I go to move that part of my body, the same reflex that occurred when that event took place in the past is now being expressed here in the present moment. And so if it's something traumatic, and then I have a sympathetic physical reflex that happens as a result of it, then every time I move my body, I'm also fight or flight.
So over time, or even during a session, you find maybe resolution in that specific part of the body.
Yes, and that's where body mapping comes in. And so body mapping, there's different ways that we can go about mapping the structure, but generally we go about it by mapping 2 points of location. And very specific to location and not sensation. But when we put our attention on 2 points of location, that starts to stimulate some neurological cellular activity in the area, which gains the attention of your sensory nerves in the area. And we have an increase of sensory data to our brain. More specifically, it's the sensory motor cortex, which has a map of your body. And that increase of information allows the brain's map to be updated so it more accurately reflects the body. That allows your motor cortex to send out a new motor pattern to that part of your body that you're mapping. And if I get a new motor pattern, then the old reflex often gets expressed, which is why often at times those memories start to pop up. But as it's expressed, and now I'm inputting a new motor pattern, then I no longer have to have the sympathetic reflexes express themselves in the present moment every time I think about that event from the past.
So in layman's terms, that means the nervous system holds on to that structural belief when the trauma happened, and by body mapping, it sends a signal to the nervous system to reevaluate the bone structure. Is that it?
So our bone structure is organized in a different way, depending on whether we're parasympathetic or fight or flight.
One of the most interesting points that working with you is it took me months for you to get this into my head, or for me to understand comprehensively what you meant. It's the actual subconscious or the nervous system that holds our bones in the placement in which they currently are. Is that correct?
Correct. And it also determines how they move. So it's not just a placement, it's not just an organization, but it's how they participate in movement, whether movement is sitting and standing, going for a walk, playing a sport. So our bones, they move.
Okay.
And they have either motor patterns, which are things that are associated with our parasympathetic nervous system, or they have motor reflexes, which are part of our sympathetic fight or flight nervous system. And when I sit and stand or walk or play a sport, my bones move with either a motor pattern or a motor reflex. And so that's one of the weird things about weird and cool, if you ask me. But our bones aren't just placeholders. They're not just things for muscles to attach to, but they actually move around. And so the analogy that I often give is that if you think about a milkshake, and the milkshake is just sitting on the table, the cup is like your skin. The milkshake itself is like your muscles, but the straw is like your bones. And the straw can move around the cup without the cup moving around on the table. So the straw can get closer to the front of the cup or the back of the cup. Just like your femur bone, your upper leg bone, could be more to the front, more in your quadriceps, or it could be more to the back, more in your hamstrings. And where it's at is determined by your nervous system. And more specifically, whether your nervous system is in a fight or flight or parasympathetic state, that determines where your femur is located, which then determines how your femur moves when you're sitting, standing, walking, or playing a sport.
And how the femur connects to both sides of the top and bottom of the bones.
Absolutely.
So it relates to the hip and the knee and everything else.
Absolutely. And putting it back in a nervous system perspective, when I'm in a fight or flight state, the amount of joint space is decreased, if any, if there's any left. So my femur, my tibia, which basically makes my knee joint, there's no more joint space left when I'm functioning in a fight or flight state. On the flip side, if I'm parasympathetic, there's at least some kind of space between those two bones. And that can be said of the hip joint as well. So if I'm fight or flight, I've got a closed joint. So it's like bone on bone, but most people are still going to have some sort of cartilage in there too. But if I'm in a parasympathetic state, then there's joint space between there, which means I have less wearing and tearing of cartilage or ligaments or whatever might be in that particular joint space.
So let me break this down for the listener, okay? If you and I are in a session and we work on my femur, I can't just say, hey, femur, shift into optimal placement for my body, because my femur would not listen to the English that I'm speaking it, right? So if I say to my femur, hey, can you place it yourself? My femur's probably not going to do anything. But when we start to map 2 points, it takes the brain out and allows the subconscious to take over and reevaluate in the moment and say, this is not an optimal placement.
You actually might be able to move your bone around. So if you have enough intention, then your body can fulfill that. It doesn't mean, though, that where you move the bone to is the best placement for your nervous system or for the activity that you're doing or position that would be relevant to whatever the moment brings you.
Yes. And so I just want to simplify this for people by observing the bones in the body slightly differently or from a 2-point perspective. It allows optimal placement of the skeletal structure.
Yes. And so as I'm mapping my 2 points, then that allows my nervous system to adapt the placement on my femur. And so it is relevant to that movement. It is relevant to the task. It is relevant to that moment, which might be different in 10 seconds, might be different in 5 minutes, but it allows the adaptation to take place in relevant to its current state, as opposed to what I think is best or you think is best or what somebody learned in school is best. It's your body, it's your unconscious brain that is determining the best organization and movement pattern for you at that moment.
Yeah, so it's our innate intelligence taking over if we relinquish that. Yeah.
Yes. It also allows adaptability. And so if I have a fixed idea about how my femur is supposed to move or how it's supposed to be situated within my femur, it doesn't allow me very much adaptability. But if I allow my unconscious brain to do that, then it'll act appropriately for whatever I'm doing. Which, if I'm in a moment where being fight or flight actually is appropriate, then my body can respond appropriately to that fight or flight moment. On the other hand, if my environment is perfectly safe, and my unconscious brain also believes that I am safe, then my body can organize and move in a parasympathetic manner with parasympathetic motor patterns.
So let's use a real life example. There are no more tigers, right? So
Right?
our nervous system was designed to flee from a bear or a tiger or something traumatic or something dangerous.
Mm-hmm.
Whereas now, sometimes we get triggered by checking an email or going into a social situation or going to the mall.
Yep.
That's our empathy, a lot of other factors factoring in. How does the nervous system respond in our present day when there are no more tigers, and yet it sees everything as maybe a minor reason to go into the 7 stages of fight or flight?
So my brain responds to my perception of the environment, and furthermore, my unconscious perception of the environment. And so if my unconscious brain perceives that there's some sort of threat in my email, or there's some sort of threat if I'm going to go talk to my boss, then my nervous system will change everything about my entire body to meet a fight or flight flee situation, even though there's no actual real threat coming at me.
And what I want to talk about for the rest of the time is the 7 stages of the fight or flight.
Yes.
And how they affect us. And for those of us listening, it turns us into people pleasers at some stages. And in the very extreme cases, particularly in childhood, it creates narcissists.
Mm-hmm.
Because a lot of people here either have family members who are narcissists, or they're overly empathic, or they're a combination of the two. And so I know from working with you that some of the higher stages create narcissistic qualities that can go overboard and turn people into like malignant narcissists that we see in the movies or that are out there. They're rare, but they do exist, right?
Sure.
So, but there's stages of people pleasing, which is in stage, I think, 4 or 5. And then as you get higher up, you get more into why people become narcissists, because they're trying to protect themselves from a shame event or something from their childhood, correct?
Absolutely. But I would argue that furthermore, narcissistic behaviors come out of all of us.
Mm-hmm, of course.
And so not just the ones that we've pegged as narcissists because their behavior exudes that, but if I'm in a fight or flight state and my unconscious brain decides that stage 6 is most appropriate, I might start to have behaviors that are narcissistic. They might not be as loud, they might not be as colorful, but that still doesn't negate the fact that I am at that moment behaving with narcissistic tendencies. And so
Right.
all of us can go there, all of us.
Right, but some of us get stuck in some of these stages.
Absolutely.
And what I find interesting, and I'm going to equate this to the intuition here, is a lot of these valves and chambers that you talk about, and I can list some of the books as resources that Amy uses that I find thoroughly intriguing. One is called Emotional Anatomy from the 70s or 80s. That book is wonderful.
1985.
Yeah, I think it's a great title as well. It talks a lot about why the body can be affected by our thoughts, and our nervous system can be affected by our exterior and our environments and the actions of others. I talk a lot in my work about judgment. If you perceive judgment, that's a fight or flight response, because you have to protect yourself from that. Even if you judge someone, that picks up the fight or flight even into stage 2, which that's you just having a thought. But if it's a judgmental thought, you're going to start turning up or ramping up your nervous system into the fight or flight response, which I find extremely harrowing because of like Instagram and what we're inundated with. Those are all judgment factors of how do I relate myself versus this person, as
Right.
opposed to being curious, et cetera. I talk about this a lot. So I'm curious, what would stage 1, for example, feel like?
So stage 1 is nicknamed startle. As an example, if I heard a loud noise in my home, it would trigger my need to investigate the loud noise. And so I might find that it was just the wind, my door slammed closed, and however long, 60, 90 seconds later, I could return to being parasympathetic. If I were to find that the loud noise was actually an intruder, then my nervous system would continue down the fight or flight continuum to whatever stage would be appropriate to meet that intruder.
Right. So the first stage is heightened state of alertness. Mm-hmm. And that involves the heart and the amygdala saying, hey, what's up?
Sure.
And then the second stage is, oh, no, we're fine. And we go back to 1. Or we go into 2 or 3. That's where I think judgment starts. but
So
it can get a lot worse depending on the situation or the immediate need to respond. So the second stage is fight, I believe.
fight. And more specifically, it's fight to defend myself. And so if that intruder came in, then I might want to fight to defend myself. And maybe it's that I need to physically fight, or it could be that if there's a verbal altercation going on, then I might verbally defend myself. Or an example that I like to use a lot, if I'm talking politics with somebody, I might defend my political stance.
In stage 2.
In stage 2.
And also in stage 2, that's the very beginning of the elimination of sensory input, right? It starts limiting what you pick up and sticking to like the 5 senses or even 4 senses.
I regard the body as having 19 senses, but there's
Okay.
5 primary ones.
Mhm.
And so with the example of fight, if I'm going to actually enter into a physical fight, my facial structure, for example, might reorganize. And so my nerves pull away from the surface of my skin. And so I get less sensory information. And if I get punched in the face, having less information about being punched in the face would be valuable in terms of helping me get out of that situation.
Right, but even if you're still debating if it's the fight or flight, in the fight mode in stage 2, you like furrow your brow, correct? And your brow gets more tense?
You could, not necessarily, but there's going to be a narrowing of the eye sockets. It's kind of like tunnel vision, where I'm going to start to narrow my vision to my threat.
And this is once again where I want to equate it to intuition, because that's where your third eye is. So if you start limiting your occipital bone in the back and the ocular bones in the front, that in my world creates a contraction or a stifling of the intuitive sense, or the upward intuition, the higher crown, 6 and 7 chakras. And I think it's also interesting, if we talk about these valves, a lot of these valves correspond to what we think where the chakras are. The feet, for example, a lot of people consider that the 11th chakra. That's a lot of input for us. The feet bring in so much more information than we really give it credit for, because we encase them in plastic shoes. And so we're not getting input from our feet, which our feet are so used to being connected to our eye movement, creating space and time.
Absolutely.
So if we go from stage 2 into stage 3, that's the flight or the disassociation state. And
Correct.
This is where it starts getting interesting in terms of how we change who we are.
Sure. So if I'm in the natural environment, stage 3 is turn and run. So if I can't fight off my predator, I'm going to run away from it. In the real world, that might be I'm going to avoid opening my email, or it's that I'm going to choose not to go to certain events because I'm avoiding whatever might happen there. Or it might be more internal. So if I can't flee from my actual environment, my actual external environment, then I'll start to disassociate from my body.
And I'd written some notes here. Stage 3 is you can move easily from one belief system to the next. And it's sort of an internal, do I hold my ground or not?
Whichever one's going to work for the moment.
And that can be very confusing, because when I was doing this research, I was like, wow, the chaos theory that, when chaos is created, then they can come in and create control. And that's a balance thing. So I think our current media really plays off of this. Our sort of binary media that says we have 2 sides. It really is a way of making sure that the populace is sort of always associating currently in this third stage.
It does make sense. And I think actually our society is much further along than stage 3.
I agree, but I'm saying this is the way they get in, by creating a binary, by creating chaos versus control. If you have a belief system, you either stick with it or change it periodically to make sure that you feel safe, as opposed to just knowing who you are and being authentic.
Sure, absolutely.
Okay, so we go from stage 3, the disassociation stage, into the freeze stage, which is the 4th out of the 7.
Yes, so that's where, again, back to our natural environment, if I can't fight off my predator, I can't run from my predator, then I'm going to play dead. And in our world, freeze might be that I can't make a decision. Or it might be I made a decision, but I'm not taking action to fulfill that decision. So there's a lack of action taking place.
And there's also, this could be where you decide to start hiding, correct?
Sure, absolutely.
Because the later stages is more about what degree are you hiding your sense of self.
Yes.
So this
Yep.
is once again tying it intuition. Being intuitive is having your own sense of self and speaking your truth or speaking what you pick up. And if your senses are diminished and you're not picking up other sensory input other than the basic senses, your intuition shuts down. And now you're only coming at things from a very emotional standpoint, right? Because the ego
Absolutely.
gets farther involved the higher we go up on the scale. But some concept I talk about with my clients is, I try to encourage people to take that little voice, that little intuitive voice, and make it their voice. Instead of it being a little whisper and them not listening to it, creating it and saying, wow, that little voice, I understand that voice. I'm going to make it more of who I am and engage on it. But it would be this free state that you have to decide whether I take my little voice and put it away and don't listen to it, or switch back into more of a parasympathetic state. So I'm curious, would this stage be for like little children? A lot of times when I work with clients, I'll get their contractive moment is from their childhood. And so when I get them in that childhood standpoint, they'll be in that but stage where children get, where their brain is like faster than their mouth and they can't defend themselves. So the kids go, but. Do you know what I'm talking about?
I do.
Would that be considered stage 4?
Could be any of the stages, because what gets convoluted is that we can go through the stages really fast.
Correct.
And we don't go through them in order.
And also part of the body can go through one stage while another part of the body can go through a different stage.
Yes. Typically our legs and our chest are in the same stage, and our head and the pelvis are in the same stage. And generally the head and the pelvis are a stage further along than the rib cage and the legs.
So this freeze, it also restricts our sort of reinforcing of what we believe, correct?
Well, we start to create stories.
Yeah, tell me about that.
And so stories, if I'm not getting enough information about the reality of my environment, then I start to create stories to explain what I'm experiencing. And those stories are a little bit different depending on what stage of fight or flight that I'm in, but it's a way of explaining my experience of the world. And then again, the story might change. And so if I'm in a flee pattern, I might come up with excuses why I can't do something, which is, that's freeze. I'm not taking action.
Well, and we stop adapting our positioning. We stop taking in new information.
Yes.
So
and
if
we
you're
lose adaptability, both in terms of our psychological function, our behavior, and our physiological function.
And so I would state that anything after stage 4, your intuition is no longer really trustworthy, because you're not picking up new vital information. You're just picking up what's absolutely necessary for survival. So the free state, stage number 4, becomes stage number 5, which is the first version of collapse. There's 2 versions of collapse, right?
Yes. And so the stages 2 through 4, those are considered to be the stages of activation. And so I have to be very active, physically active, to engage in those behaviors. Once I get into stage 5, 6, and 7, I'm now in the stages of conservation. In stage 5, it's called collapse 1, but it's also like fawning. And fawning is a term that is quite popular in describing fight or flight based behaviors.
Expand fawning for us.
So fawning, that's people pleasing.
Yes.
That's the big behavior that happens in stage 5. Stage 5 is also where anxiety and depression are really common. Stage 5, with the people pleasing, that's where we are interacting with people in such a way to get them to fulfill whatever needs that aren't being met, whatever needs that we can't fulfill for our own selves.
So you feel like a lack of upward support, right? And that creates like a fatigue or lethargy in people, that I can't get out of bed.
It can. It's different from one person to the next. And so while some people might experience chronic fatigue, or they might experience depression, or they might experience lethargy, another person might be as happy as a clam. And so that's where how we present on the outside doesn't necessarily match what's happening on the inside. For some people, stage 5 is a great place to be, because the way we label our experience is going to be different from one person to the next. Right. And so while some people experience chronic fatigue and some people experience depression, other people are, because they're people pleasers, they might be highly involved with all kinds of activities and all kinds of people. And so they're very involved in life. They're physiologically tanked. Their nervous system is tanked. Their valve system is tanked. But because of their people pleasing activities, they're getting survival needs met. So they feel good.
Got it. So their inner view takes over and misinterprets the signals.
Mm-hmm.
And that's stage 5. And there's also that need for approval in stage 5, correct?
Yes. Yep.
Yeah. And the way I looked at this when I was taking notes on it is it sort of allows judgment of others to change our mind.
Yeah.
And so that's where this gets really tricky for empaths. And where I say joy and judgment can't live in the same moment is this stage 5, you really have to decide. Like, are you being affected by it intrinsically in your nervous system, or you can scale down 3, 2, 1 back to parasympathetic?
Well, and all those choices aren't
Mhm.
being made consciously,
Correct.
right? And so whether our behaviors that we're engaging in, if they're not meeting our needs, and that's when we're going to take a different tactic. And that's generally when there's a shift in which state we're hanging out in that moment.
Once again, going back higher up the stages into the ego. So stage 6 is collapse stage number 2. How does that differ from stage 5?
So collapse 2 starts with victim. And by victim, I don't mean a person that's actually been victimized. I mean somebody that's, say, feeling sorry for themselves, or they're playing the victim card, for example, poor me. That goes into a martyr. And then at the end, kind of the last third of stage 6 is where the narcissism pops in.
And I find it interesting because the victimhood in my work is an archetypal state, and the victim is the shadow state, and the enlightened form is self-esteem. I would say, looking at this through my lens, is stage 6 is essentially where your self-esteem plummets or leaves the building. So you are struggling to even survive. If you're in that victim mindset or that shadow victim, it really helps to find your own sense of self-esteem, whether that can be just the smallest win. I'm going to drink a glass of water, and you drink that glass of water. That can help shift you back in being a small, esteemable act.
Sure.
Right? And those esteemable acts can build up. But when people feel like they've given up or that the world isn't on their side, that victim shadow really can take over and start changing their ego and what they say about themselves, right? Mm-hmm. So there's like an old story versus a new story, and the subconscious has to differentiate those.
So there can be an old story versus new story. Old story could be the story of myself before I entered into this prolonged fight or flight response. Because by the time somebody's hanging out in stage 6, they've probably been dominantly fight or flight for a period of time. Old story could be the story of me before I was in a dominant stage 6 fight or flight response. Old story could also be the story that I was when I was dominantly in a different stage, versus my new story is the story that I currently am working with, to both explain myself to other people, but also to explain how I fit into this world, and to explain the sensory information that doesn't really make sense because I'm not getting enough of it to really explain reality.
So if you have a malign story, that will ultimately lead to a structural imbalance in your nervous system via the skeletal system, correct?
Sure. And probably faster than what one believes.
And that's what your work is to regulate that, see it for what it is, and let the body process the information in real time and make its own decision.
Yeah. And so the process of mapping increases that sensory input. And so our brain can start to have a more accurate sense of its reality. And thus my story can start to be different. Over time, that story can start to be more consistent with reality. And so not just my perception of reality, but actual reality.
And that actual reality can change your skeletal structure to support your body more efficiently or optimally.
Yes, but they happen at the same time. Because I'm either all parasympathetic or I'm all fight or flight. And so depending on which side of that coin that I'm on, everything's going to be different. Over time, that's where I might start to change my dominant state of fight or flight that I'm in. And so there's gradual changes, but at the same time, from any one moment to the next, I'm either one or the other. So even somebody that's primarily a narcissist is still going to have moments where they're parasympathetic. Probably those moments don't make a lot of sense to them, but they still have moments of being parasympathetic.
Part of their body will become parasympathetic.
All of it. You're
all
either
of it.
all parasympathetic or you're all fight or flight. It just depends on what that moment is presenting. And so for some of my clients, the state of parasympathetic is startling, and it startles them right back into their fight or flight state. So they might not stay there for very long, right? Or if I'm dominantly stage 6 is also, especially if I'm in the narcissist stage, that again, is a stage that might actually feel good, right? And if I'm now in a parasympathetic state where I have a lot of increased sensory input, that often doesn't feel good. Getting all that
Well,
extra
right.
input physically can be overwhelming, mentally can be overwhelming, and is enough to send me right back to fight or flight.
Well, that's like saying we can feel placated by a sugary dessert, even though we know what it's actually doing inside of ourselves is changing our blood sugar and everything else, and that sugar isn't doing any good for us in the long run, but in the temporary, it feels good. It feels
Absolutely.
placating, right? That's why the narcissist who's self-absorbed, the more self-absorbed they become, it feels placating, even though it's not good for themselves or the environment in the long run.
Sure.
Okay, so we're almost done, and we're going to the 7th stage, which is rigor and extreme shock.
hmm So
Um,
that's one most people understand from having a traumatic accident. So if you're like hit by a car, whether you're a pedestrian or you're in a car, somebody that's like profusely bleeding from their head and they're in a state of shock, and usually the responders will put a blanket around them or something like that. That's shock. And that's an extreme version of shock, but a person can literally go parasympathetic, skip stages 1 through 6, and go straight to stage 7 in those cases. Or somebody might be in stage 7 more long term. And so they can have rigor. Rigor, most people think of as something that is associated with death, say rigor mortis. But you can have rigor when you are alive. And that might literally look like rigor. So a person doesn't move very well, their joints don't move very well, their bones and their fascia are really brittle, really hard, and they literally can't move their elbows very well. They can't look over their head. So they might have a state of rigor that looks like that. Or stage 7 could look like somebody that's highly athletic. They present very fit and very healthy, but yet their bowel system is tanked.
because they're desperately trying to keep up with their internal excitability. Is that it?
Well, usually because their bowel system is tanked, they have to engage in high levels of activity, whether something that's just really rigorous or
Mm-hmm.
that's something that has like jumping out of an airplane. So there's a lot of adrenaline involved in it. And those activities are what keeps them going since their bowel system isn't doing it for them.
And so there's an aspect of this last stage for people who say are long-term or lifelong narcissists. Because once that happens in your childhood, it's really difficult to shift out of that, right?
Mhm.
Long term. A true narcissist, it's very hard or almost impossible that they would actually change.
True.
But I'm curious, there's an aspect of this last part that if you really are so scared from a 5-year-old perspective that you can't exist as a 40-year-old without maligning other people or making yourself feel better because you're making someone else feel worse, right?
Mhm.
There's an aspect that I have about if somebody in this long-term state tries to help them, it actually triggers this more, and then they have an issue with like they bite the hand that feeds them. And that's why people that are stuck in this stage from a young age and part of their body, they make up their own stories and create their own reality that only serves them. And then when the empath comes to try and help that situation, that person who receives it feels so uncomfortable with who they are that then they turn on the person that's helping them. And that all comes from this last 6th and 7th stage, correct?
The stages aren't that clear cut in
Sure.
reality, right? And
Yeah, of
so,
course.
behavior wise, the narcissist, if I go back to that example of politics, right? And I'm
Hmm.
trying to defend my position, that's stage 2. But if I'm trying to make you have the same opinion as me, that's stage 6 narcissism. From the stage 7 people that I work with, they're not a bite the hand that feeds type. None of them are.
And you work with people at stage 7, they don't
I
really
do
want
work
to.
with
Oh, you
narcissists.
do?
And
Oh,
I
I guess.
have several clients that are stage 7 too. And so, in my experience of working with people of stage 7, one of them's a therapist. She's a very kind person.
And
hmm
we have them in our culture. And these are the people that are stuck in some sort of shame loop.
hmm
Where is the shame loop? Is that stage 6?
That can happen actually quite early. That can happen in the earlier stages of fight or flight. Speaking from my perspective, my modality, shame is something that might prevent us from doing something, or it might be something that causes us to engage in certain behaviors to get our needs met. Well, the body part that comes to my mind is your talus. So
Hmm.
the talus is your moving forward bone. And so whether that's very
What part of the
literal,
body is the talus?
that's the ankle one. So it sits right underneath your shin bone.
Hmm.
And so it's It's a little bit of a pivoting type of bone, so allows your foot to flex and point. It's considered to be your moving forward bone. But if that bone is stuck, right, generally people also feel stuck. And a lot of times the feeling of stuck is that there's shame or there's guilt in moving forward because they're leaving behind somebody else. And so that behavior probably started somewhere in childhood. And it doesn't necessarily always pop up, but when something about moving forward, whatever that might mean to you or however that might be relevant to you at this point in time, then that's when we often experience shame or guilt or something of that nature.
And that changes how our outlook is. I want to thank you for being here, but every time you and I speak, I'm always left with some pearl or nugget of wisdom that makes me slightly reevaluate how I interpret information. So what are 2 or 3 little tips that you frequently find yourself repeating to clients that they go, oh, I never saw it from that perspective?
One of the things that I repeat a lot is that you don't have control. And the idea that you have control is fight or flight. Trying to have control is fight or flight. But when we start to accept the reality of our moment, it is what it is. It's not good. It's not bad. It's not right. It's not wrong. Then that allows our nervous system to actually take in more input on its own. And then furthermore, I can speed that process up by mapping.
I really enjoy how your work and my work are so congruous, how they're so in sync. Because something I repeat very often is accept the existing reality. When you accept the existing reality, then you're not judging it, you're accepting for what it is, and then your nervous system can start bringing in more sensory input. Yes. So that's where you and I, our work once again complements each other. Yes. What else do you find yourself saying a lot of?
Map your body. All the time. That's what I say all the time. But I also say in context of like, if you find something that seems to be wrong, don't assume that it's bad or don't assume that it actually is wrong. So if I'm getting some sort of feedback from my structure, that feedback might actually be me shifting towards parasympathetic because change sucks, right? Change is uncomfortable. And so if I'm changing to parasympathetic, which is generally where most people want to go, they have to allow themselves to be uncomfortable. They have to allow themselves to experience sensations that they don't like. And if I'm not sure if this change is parasympathetic, maybe it's a fight or flight, then I have to go back and look at my structure. I cannot base it on how I feel. I have to look at my structure. And even then, if I'm not sure what that means, then I go back to the mapping process. And the mapping process could be as easy as putting your awareness on your tongue, any part of your tongue, and your chin. And if you take your attention back and forth between those 2 points for about 2 minutes, that starts to engage the sensory system and is likely to shift something about your experience. It might not change the sensation. It might not change how uncomfortable it is, but it allows you to go through it instead of turning away from it.
And that going through it is a potential for change.
Exactly.
Whereas if you turn away from it, you're going to be sort of reduced to what you came in with, which is a fight or flight response, whether it's 1 to 7. Yeah. Mm-hmm. Well, I'm very pleased to have you on. I believe in your work. I'm a fan of your work. I recommend you highly. And I'm still amazed every week we work together, what my body is able to respond by just the simple work that we do. This is not a physical work. There is movement involved, but this isn't about lifting things up and putting them down. It's about reevaluating your internal structure and having that suit you more optimally.
Absolutely.
Yeah. So any last words for the group?
Keep paying attention to your structure. That's what I keep saying over and over again. So.
And the more you pay attention to your structure, the more you will become parasympathetic.
The more it increases information to your brain, so your unconscious brain can choose what's appropriate for the moment.
Well said. Amy, thank you so much for being here. I think what you do is absolutely magical. I think it's super important in terms of helping people understand themselves better. So how do people get a hold of you if they'd like a session?
So you can always go to my website. It's prismmovement.com. And there's a contact me page, and you can pop me an email from there. You can also find me at Instagram at Prism Movement Studio. And I have a little bit of stuff up there that you might be curious or interested about.
And you do one-on-one, and then you also hold classes. Is that correct?
I teach one-on-one, both in person and on Zoom. And then I teach group classes. And at the moment, group classes are also only on Zoom.
Yes. And when Amy and I work together, it is Zoom exclusively.
Yep.
And as I said, the results I think are just stellar, and I'm happy to be in my body after we work together. So I thank you, and thanks for being here.
Thank you for having me.
You've been listening to the Intuitive Energy Podcast with me, Scott Clover. Thanks to Corey Tutt for the music you're listening to. In my private practice, I encourage people to heal what holds you back and feel better in your body. If you need more help with that process, I'm available for healing sessions by phone internationally. Visit scottclover.com for more information. Be well, and thanks for listening. This podcast is for educational and informational purposes only, and solely as a self-help tool for your own use. I'm not providing medical, psychological, or nutrition therapy advice. You should not use this information to diagnose or treat any health problems or illnesses without consulting your own medical practitioner. Always seek the advice of your own medical practitioner and/or mental health provider about your specific health situation. For my full disclaimer, please go to scottclover.com/disclaimer.